we all have those insecurities that weigh a lot heavier on ourselves. Do whatever makes you feel best about yourself. So my name is Joseph. I'm gonna be getting a mole removal today, which I've already had it removed, so this is gonna be my second time doing it. Unfortunately, I did not know that moles can grow back if you didn't do it the right way. I did not get the mole removed here. It was actually through the military VA. I don't know if they sent me to the wrong person or I don't know what happened there, but it did not end up being the right procedure. So initially I had it shaved off and then cauterized, and this time I'm gonna be actually having it cut open and like the root pulled out, which is the proper way to do it for most moles. I've gone down a creative path, so I kind of need to have like clear skin and like a smoother face, and my mole right here was really big and now it's turned into scar tissue plus a mole growing back, so I have to get it fixed. And I initially wanted to get it removed when I was a little kid. Like the first time I really noticed, I was like 10 years old and I was in school and kids were just always asking like, what's on your face? Like, what is that? I was very insecure about it. You know, it seems like such a small thing, but we all have those insecurities that weigh a lot heavier on ourselves. Aesthetics is an art form, and the way that you look, the way that you present yourself to the world is a form of communication and art. And I think that we should all do our best to communicate as well as we can and to be the most confident versions of ourselves. So you do whatever makes you feel best about yourself.
Got my friend Joseph here, and we're gonna be taking care of this recurrent mole. It's kind of a mole with a hypertrophic scar right here. Had it for a little while, had a dermatologist do a shave excision of it. Totally valid thing to do, but unfortunately it started to grow back and it grew back with this kind of red raised scar. So we wanna get it out. We're gonna do a full thickness excision of it. Fortunately, it's in a nice spot. I'm gonna be able to try to hide it right here in this natural crease. So we're gonna do a little diamond shaped excision, close it up nice. Hardly see it once we're all healed up. Full thickness, just through the skin and dermis, left all the underlying muscle intact here. So we're gonna send this off to the lab for the pathologist to evaluate, just like I do with every single skin lesion. So this came together absolutely beautifully. A few critical aspects. First was incision planning, making sure we planned it within a natural crease in a low tension area. Second was a full thickness excision that I was then able to undermine, so a zero tension closure, and then zero tension on that top layer of skin by putting in a deep layer of dissolving stitches so that that top layer is closed just ever so slight tension to approximate the skin. Critical step is we're gonna put on this silicone dressing. Helps kind of maintain an adequately moist environment as well as kind of balance the charge, the electric charge of the skin. We're gonna be using silicone for the next few weeks to help this heal so that it's almost imperceivable by about 6 to 12 weeks. We just finished up with our mole or scar removal right here in the lower lip. Came out really nice. Did a little diamond shaped excision so that it heals straight in this natural crease here. No tension, multi-layer closure, silicone right away. It's gonna heal beautifully in probably about 2-3 months. It'll look invisible. So we're a week out from excision of this skin lesion here on the lower lip. Got the pathology back, because I always send these off to pathology. A little interesting, something called a trichoepithelioma. Totally benign tumor based off of a hair follicle. So nothing to be scared about, but definitely needs to be totally removed, so avoid recurrence. So fortunately you did that. Removed it all the way down to its base. Got the stitches out. This is healing in beautifully. Obviously still a little bit red and inflamed. That's gonna get better over the next couple weeks. So we were talking that for the next week, we're gonna do some light moisturizer, a little bit of just Vaseline over top. And I wanted to keep using some silicone scar shields. These little silicone scar dots are awesome. Silicone is really the only thing scientifically proven to improve scar healing. And then next week, once the scar's healed a little bit better, we're gonna start using some silicone scar gel, do some scar massage, help break things down. I'm pumped. We're off to a good start.
Oh boy, I think it's like 4 months now. The results are pretty good. Starting to smooth out quite a bit to where even my girlfriend just said the other day, she's like, oh, I don't even like really notice that you have it anymore. So that's great. I feel a lot better about it. It's like to the point to where I don't really think about it too much, but when I look back, I'm like, okay, yeah, I'm glad I don't have to deal with that anymore. I personally did not get my mole removed for a long time out of fear of like surgery or fear that it was gonna deform my face because it was so close to my lip. And then also there was like the mental aspect of like, oh, if I get this removed, that means I'm admitting that there's something wrong with me. You know, just don't think too deep into it. You know, if there's something that you want to do for yourself to make you more confident or improve your personal aesthetic, then just do it. It's really not that deep. It's not that big of a deal. If anybody else has something to say about it, then, well, sucks to be them. Do it.